we're plunging into a really important topic, benzodiazepines. You probably know them as Benzos. We're going to unpack what these drugs are, how they work in your body, and some, well, absolutely crucial stuff you need to know.
Right.
Because, they're prescribed a lot for things like stress, anxiety, sleep, but they're also out there recreationally.
Exactly. And our mission today is really to pull out the key insights from the material we've looked at, give you a shortcut, sort of, to being properly informed about benzos.
Okay.
Understanding the nuances, the implications, why it all matters, really.
Okay, so let's get into it. Benzos are depressants, right? Central nervous system depressants.
Yep, that's the core mechanism. They slow things down in the brain.
Which brings that relaxation. Now, there are different types. Long, medium, short-acting.
That's right. And that distinction is critical.
How so?
Well, the source material is pretty clear. Short-acting ones, think like Xanax, they generally pack a stronger withdrawal, a harder come down.
Oh.
And they can be more addictive than the long-acting types, like Valium.
Yeah.
It's a really key difference.
Gotcha. So besides relaxation and sleepiness, what else are we talking about effects-wise?
Well, those are the main intended effects, reducing tension, anxiety. But because they're depressants, you also get these other physical things.
Like what?
Things like slowed breathing rate, slowed heart rate, decreased motor skills, so maybe lack of coordination, even slurring of speech sometimes. These aren't, super rare side effects. They're tied directly to how the drug works.
Okay, here's something that really jumped out at me from the sources. This idea of the half-life. It can be incredibly long.
Oh, absolutely. That's a huge point.
So even if you feel like it's worn off after a few hours, the drug is still active for like days.
Yeah, up to 1 to 3 days in some cases. It hangs around in your system much longer than the noticeable effects might suggest.
Wow. Okay, so what does that mean practically? Like if someone takes one and then thinks about having a drink later or taking something else?
Right, and this is where it gets incredibly dangerous. That long half-life directly links to the risks of polydrug use.
Mixing drugs.
Exactly. Combining benzos with other depressants, opioids, alcohol, ketamine, GHB, it's just dangerous. Full stop.
How dangerous.
We're talking overdose, losing consciousness, severe breathing difficulties, leading potentially to respiratory failure and death.
So it's really that serious, an absolute no-go.
It's an absolute no-go. The risk is just too high. Even mixing with stimulants is tricky because the benzo can mask the stimulant's effects, but both drugs are still active, which can lead to, well, unexpected problems.
Yeah, and this dependence thing sounds like it can happen fast.
It really can. Our sources suggest physical dependence can develop within just a couple of days of regular use sometimes.
A couple of days.
Yeah, and withdrawal from benzos, it's not something to take lightly. The side effects can be extreme.
Even fatal, I read.
Yes, potentially fatal if not managed correctly. It's why withdrawal, if it's necessary, really should be done in a hospital setting under medical supervision.
Okay, so given all this, the risks, the half-life, dependence, what are the key harm reduction points people need to keep in mind, practically?
Well, the core principles always apply. Know your body and mind, you're set. Understand how you might react.
Right.
Know your environment you're setting. Be aware of where you are, who you're with.
Makes sense.
And crucially for benzos, know your drug. This is huge. Meaning, know the source. If it's prescribed, it's regulated. But if it's from an unregulated market, you could be looking at counterfeit pills.
Unknown substances, unknown doses.
Exactly. Huge risk there. And knowing your drug also means knowing the type. Is it short-acting, long-acting? Because that affects the risks, the half-life.
Got it. And what about things like drug tests? Do these show up?
It's interesting. They're not typically part of standard roadside drug tests, but, and this is important, police can still assess you for behavioral impairment.
Okay.
And workplace drug policies. That's a different story. They might well test for benzos.
Right. Okay, so wrapping this up for you listening.
Yeah.
Benzodiazepines are clearly powerful drugs. They have varied effects, but also really significant risks, especially that long half-life and the dangers of mixing them with other stuff.
Absolutely.
So knowing your source, knowing the specific type of benzo, it's just paramount, isn't it?
It truly is. And maybe a final thought to leave you with. Considering how complex even these commonly prescribed drugs like benzos are, what does this deep dive really tell us about how important it is to critically look at any substance we put into our bodies? And maybe who should be responsible for making sure we all get comprehensive, unbiased information?
Definitely something to think about.